Hi, my name is Sloan Wagstaff and I will be narrating this video. This presentation is about the treatment of depression. In order to talk about how to treat depression, it is appropriate for us to understand what it is, what it means, and where it comes from. Now, depression is the reduction in the ability to think, feel, and behave. And there are many forms of depression, but the three hallmark features that make these disorders different from others are anhedonia, lethargy, and excessive sadness. In psychology, we believe that the best way to treat mental disorders, including depressive disorders, is through what is called concomitant treatment, or in other words, combined therapy. This form of therapy uses psychotherapy and pharmaceutical therapy to stop symptoms of relaying disorders. It is important to note that within the treatment of depression, we use the model of the monoamine theory. The monoamine theory is the belief that someone displaying symptoms of depression has a decrease of monoamines within the brain, including serotonin, dopamine, and norepinephrine. What are some pharmaceutical drugs prescribed to patients with depression to help increase their needed monoamines? Well, there are the monoamine oxidase inhibitors, or the MAOIs, the tricyclic antidepressants, or the TCAs, there are the selective serotonin reuptake inhibitors, and lastly, there are the serotonin and norepinephrine inhibitors. What are some forms of psychopathology treatment of depression? In other words, how does a therapist treat symptoms of depression? They may use cognitive therapy, cognitive behavioral therapy, dialectical behavioral therapy, or psychodynamic therapy. Cognitive therapy helps with patients' thoughts. Behavioral therapy helps to change behaviors that may affect a patient's emotions. And cognitive behavioral are a combined form of the two, which work extremely well together as thoughts lead to a specific behavior. Dialectical therapy's goal is to teach the patient how to cope with stress, to better their relationships, and how to regulate emotions properly. Lastly, the psychoanalytic therapy may be used if the patient may have unresolved conflicts originating from their childhood and may need to be discussed with their therapist so that they may put their experiences into a more understanding perspective. These are the last of treating depression professionally, but it can also be treated at home with proper sleep, exercise, diet, routine, change of thought, and change of action. These are more sources. Thank you so much for listening.